Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Mometasone. Its brand name is Nasonex. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how mometasone works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe mometasone. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does mometasone work? Well, mometasone is a corticosteroid with anti-inflammatory, antipyretic, and vasoconstrictive properties. Corticosteroids have a wide range of effects on various cell types and mediators involved in inflammation. In terms of indications or reasons we would prescribe this medication to a patient, we may see this medication used prophylactically for seasonal allergic rhinitis, may be used for allergic rhinitis, as well as nasal congestion associated with seasonal allergic rhinitis, and it can also be used for nasal polyps. In terms of contraindications or reasons we would not be able to prescribe mometasone, we just wouldn't give this medication to a patient who had a hypersensitivity to mometasone or any other component of the formulation. Note about dosing with mometasone or Nasonex. So in the treatment of allergic rhinitis, we may see 2 sprays in each nostril, which would be 50 micrograms per spray, once daily. So the total daily dose would be 200 micrograms. For the treatment of a nasal polyp, we may see 2 sprays in each nostril twice daily. So in this situation, the total daily dose would be 400 micrograms. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using mometasone, so we'll go over some of those here now. 3 to 26% of patients may experience a headache, while 4 to 9% may experience dysmenorrhea. 7% may experience a cough, and epistaxis, which would be an acute hemorrhage from the nostril, nasal cavity, or nasopharynx, may happen 1 to 13% of the time. Nasopharyngitis may occur 1 to 8% of the time, and 8 to 12% of patients may experience pharyngitis. An upper respiratory infection may happen 3 to 15% of the time. Now, some more rare but serious side effects would be bronchospasm or anaphylaxis. That's all we're going to talk about today with mometasone or Nasonex. As always, I'm very thankful you took the time to come by and watch one of my videos. If you thought the information was valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.